HER2, of course, is a target that's been around for a long time because we use it routinely in treating women with breast cancer, well, anyone with breast cancer. But for lung cancer, while it's been recognized that HER2 mutations, so not the amplification we're used to talking about in breast cancer, but actually mutations in the HER2 tyrosine kinase domain have been present in lung cancer for a long time. It's about 2% of lung adenocarcinomas have HER2 mutations. We have, unfortunately, to date, had very disappointing results with targeting this. So tyrosine kinase inhibitors that target EGFR and HER2, like afatinib, for example, or paratinib, have had trials, but have had relatively marginal efficacy and relatively short-lived effect. However, that seems to have changed recently, and this has been with the emergence of the antibody-drug conjugates. So ADCs have shown some very promising efficacy in phase 2 trials in HER2 mutant lung cancer. And over the last few years at ASCO, we've seen some of these presentations. A few years ago, we saw a phase 2 trial of trastuzumab, something that's already available on label for HER2 positive breast cancer, was treated in a cohort of patients with HER2 mutant lung cancer and had a fairly impressive 44% response rate with a decent duration of control. Probably became something that was used off-label a fair amount for HER2 positive lung cancer. And then at the oral presentation at the 2020 ASCO annual meeting, we heard about a phase 2 trial called the Destiny Lung trial of trastuzumab deruxtecan, which is also a different antibody-drug conjugate targeting HER2, tested in HER2 mutant lung cancer, had a very impressive response rate of 62%. So something comparable to what we expect to see in drugs like EGFR inhibitors in EGFR mutant lung cancer or ALK positive lung cancer, with an estimated progression-free survival of 14 months. And so for the first time, we're starting to see targeted drugs for this population that mirror targeted drugs in other molecular alterations of lung cancer.